As the nation prepares for the first full year of the Affordable Care Act, many are debating whether employers will continue to offer health insurance to their workers. For 70-plus years, employer-sponsored coverage has been the bedrock of the U.S. health system. Today, about 150 million Americans get health benefits through their jobs. But as costs have soared, many businesses have dropped coverage or shifted more of the cost onto employees. Beginning in January 2014, the new law requires most employers to offer coverage or pay a fine. And except for the poorest of the poor, individuals must carry insurance. Massachusetts passed its own health care law in 2006 and has seen coverage rise to about 98% of its population. In the 7 years since, as employer-sponsored coverage declined nationally, Massachusetts saw an uptick in the number of residents getting coverage through their employer. Why the shift? Every state and every company is different, and benefits decisions are about more than just dollars and cents. But a careful examination of the tax treatment of employer-sponsored health insurance in this country reveals some surprising findings. Meet the Smiths. Mr. and Mrs. Smith live with their son Junior in Anytown, USA. Mr. Smith works full-time at the Widget Company, where he earns $52,000 a year. Mrs. Smith also works full-time. She earns $40,000 from her job at Cogs Unlimited, but does not receive health benefits. The Widget Company, like most employers, is weighing how it compensates Mr. Smith. It can pay $52,000 in salary, or it can offer Mr. Smith a combination of health insurance and wages. Let's see what happens when the Widget Company provides insurance. Mr. Smith signs up for a family plan that costs $15,000. The Widget Company covers 80% of the plan at a cost of $12,000. That means Mr. Smith's pay will be $40,000. Mr. Smith then pays his share of the health premiums, $3,000, leaving him with $37,000 in net wages. Combined, the Smiths have household income of $77,000. In this scenario, both the Widget Company and the Smith family benefit from federal tax policy that exempts contributions to employer-sponsored health insurance. Because of this exemption, the Smiths pay $11,536 in payroll and income taxes, making their net take-home pay $65,465. The Widget Company, meanwhile, pays $2,831 in payroll taxes, reducing the net cost of employing Mr. Smith to $35,640. Now let's see what happens when the Widget Company doesn't offer health insurance. Mr. Smith receives wages of $52,000. Again, Mrs. Smith's employer doesn't offer insurance. So in order to comply with the new law's requirement that they must have health insurance, the Smiths buy a family plan on their new state insurance marketplace for $15,000. While many Americans will be eligible for subsidies to reduce the cost of coverage, the Smiths do not qualify at their income level. Now let's take a look at the tax implications of this second scenario. Unlike before, the Smiths must include in their taxable income the money they spend on health insurance, which means they owe more in taxes. And the family's net take-home pay falls to $62,367, or $3,098 less than before. The Widget Company must also pay more in payroll taxes, and under the Affordable Care Act, the company must pay a $2,000 penalty for not offering insurance. After accounting for corporate tax deductions, the net cost of employing Mr. Smith climbs to $38,386, or $2,746 more than before. In addition, many employers expect that if they eliminate health benefits, they will face pressure to increase wages to help fill the gap. Despite being paid more in cash when the Widget Company does not offer insurance, the Smith family still takes home less money at the end of the day. The Widget Company doesn't fare any better. Given the tax exclusion for employer-sponsored insurance, the least expensive way to compensate Mr. Smith is with a combination of cash and health benefits. With higher payroll taxes on employees taking effect in 2013, it will be even more advantageous for the Smiths to receive employer-sponsored health care. Employers and employees have many factors to consider when making decisions around compensation and health benefits. Recruitment and retention of workers, competition, absenteeism, and now new mandates are just a few. But as the story of the Smith family and the Widget Company shows, federal tax treatment of employer-sponsored insurance has significant value and is an important consideration for companies heading into 2014.